Representative Edwards, are you still with us?
Yes, I am, Chairman.
Okay, Representative Edwards, we're going to move on to your bill. If you would go ahead and introduce, it's House Bill 5245 on your agendas, please.
Thank you, Chairman, members of the committee. This bill we talked about a week and a half ago. The purpose of this legislation is to prevent drug overdoses by authorizing the Department of Health to create a harm reduction program for the people to safely consume their own pre-obtained controlled substances. The people who are going to testify are going to give you the best testimony out there, so I'm going to be very, very brief and let them get right to the point. But the bottom line is this legislation will save lives. Thank you for your time, and I look forward to hearing the testimony of the people behind me. Thank you, Chairman.
Thank you, Representative Edwards. We appreciate your testimony. Are there any questions from the House Committee to Representative Edwards at this time? Okay. If not, Representative Edwards, thank you for standing in with us. We're going to hear from our virtual witnesses now. We'll just have a moment. We need a moment to raise someone. If everyone would stand by for a moment. Thank you. Hello, Elizabeth.
Hi, yes.
Elizabeth, this is Representative Casey from the House Health and Human Services Committee. We have you online testifying on House Bill 5245 by Representative Edwards regarding the harm reduction centers. You, I am told, are the expert witness, so I'm going to give you a little bit of leeway with time if you need it. If you could please explain the bill and the merits of the bill, we would really appreciate that. Go ahead.
Absolutely. So my name is Dr. Elizabeth Samuels, and I'm an assistant professor of emergency medicine at Brown. I work at Rhode Island and Merriam hospitals, and I also do research focused on the overdose crisis in Rhode Island. And calling in today as expert witness, as you mentioned, in favor of House Bill 5245. In addition, I want to advocate for expanded liability provisions to ensure the effectiveness and public health benefit of this bill. So I know you discussed this bill a couple of weeks ago, and you've heard some other expert testimony about it. But just to speak briefly about harm reduction centers and their merit, as you know, Rhode Island's overdose crisis is one of the worst in the country, and over the last year it has only intensified. 2020 is our deadliest year on record. There is no one, I think, in Rhode Island whose lives has not been touched by the overdose crisis. Every overdose death, however, is preventable with prompt administration of naloxone. Absolutely every single one. None of these deaths needed to have happened. The Rhode Island drug supply is increasingly deadly and potent and really requires immediate intervention to prevent death. So Rhode Island, as you know, has prided itself on working on an evidence-based public health approach to addressing the overdose crisis, and in many ways has been a leader in developing and implementing innovative policies and programs to address this crisis. And while we have often served as a model to other states, harm reduction centers, which is the intervention proposed by this bill, also known as overdose prevention centers, are one proven evidence-based strategy we have yet to employ. There are over 120 centers in Canada, Australia, and multiple countries in Europe, and there has never been one death in a harm reduction center, not one. I think this is remarkable enough to spur us to establish such facilities in Rhode Island, but their public health benefits also include increased enrollment in addiction treatment among people who access center services, as well as reductions in overdose deaths, HIV and hepatitis C infections, public injection-related litter, and crime in the areas surrounding the centers. that these are the exact, all of the public health benefits we are striving for in Rhode Island. And in addition to them being demonstrated in multiple countries, there has been evaluations of an unsanctioned site in the United States that my submitted written testimony provides many of these citations in the literature if you want to take the time to review it. But there's a recent paper that examined crime in the neighborhood surrounding an overdose prevention center that in the United States, and it showed reductions in neighborhood crime compared to other neighborhoods. They've also, that's been in operation for several years. There has not been one death in the center, showing feasibility as well in the United States. So what this bill really allows us to do is to set up a center that is rooted in public health and harm reduction and really centering the well-being of people who use drugs and people with opioid use disorder. I care for people who have experienced an overdose during every shift I work in the emergency department, and I know that we can and must do better for our neighbors and community members who use substances. While we have significantly improved what the emergency department offers to patients after an overdose, overall ED visits for overdose are declining while deaths continue to rise. And the majority of people treated in the emergency department after an overdose, often it's not the best time to engage in on-site counseling or treatment initiation. People are not always ready to take that step. What harm reduction centers offer is a place where people can engage on their own terms with people that they trust, that they have longitudinal relationships with. This is why we see such increased treatment engagement at harm reduction centers worldwide. People have ongoing relationships where people are respected, their human dignity is respected, and they operate in a person-centered way. They work with people holistically to improve people's health and well-being. Done correctly with wraparound support services, harm reduction services, and low-threshold treatment access, harm reduction centers will save lives in Rhode Island. But for these centers to really work, the current legislation must include protection from harassment, as well as liability protections and protections from civil and criminal prosecution for people who use the centers and also center staff and building owners, which means really protecting these centers from Rhode Island's current crack hive statute, which is a key legal barrier to this increasingly vital public health intervention. This bill will allow us to do that, although I do think adding additional liability protections will really prove efficacy for this intervention. So we are in an all-hands-on-deck situation in Rhode Island on many fronts, and particularly with the overdose crisis. But to effectively deal with this crisis, we need to use every tool and strategy we have available. And quite frankly, the years and decades of evidence supporting this intervention, we are not currently using every tool and strategy we have available. Harm reduction centers have tremendous potential to reduce substance use-related illness, injury, and death, as well as improve neighborhood well-being and community well-being. They have been demonstrated to do so in other countries, and I think we really have an opportunity to lead in caring for the health and well-being of Rhode Islanders, and we should seize the chance to do so. I'm happy to answer any questions from the committee around either medical questions or public health benefits of such centers. And in my submitted written testimony, I have my contact information as well as literature if you want to take the opportunity to review that.
Thank you, Dr. Samuels. We appreciate your testimony. Are there any questions from the committee at this point for Dr. Samuels? Yes, Representative Fogarty.
Thank you very much for your testimony, Doctor. And I appreciate what you're doing here, and I think it is something that we should certainly try to do since we have really had a very poor record this past 2020. I don't know why we seem to be so bad in a smaller state. But just in regards to this just being for opioid overdoses, is there any other type of treatment that could happen for other patients who might be addicted to things that are not opioids, like some of the benzo drugs, to even like if people keep abusing those types of benzo drugs, that they could come into a center like that and learn how not to abuse their benzos, or some type of training for some other people that, aren't in the opioid crack, but are in some other type of, spectrum, part of the spectrum of drug abuse. So I'm just wondering if that center would help out, because I feel like I know that we did a thing here in South Kingstown a few years ago, and, you know, some parents who just were there and were just like, you know, telling such sad stories about their kids who who died from opioid overdoses, but other kids who were other addictions that they really couldn't control. And they just had no place to turn and go with them when they got bad. And I'm just trying to find a place for people like that.
I'm having a little bit of difficulty hearing you.
I don't want to repeat that all. I'm just.
Could the chairman maybe repeat the question?
Yes, I can try. Representative Fogarty took a few minutes. She's wondering if there are people who have addictions to other drugs other than the opioids, such as the benzo family, if they would be able to get help in the harm reduction center.
Oh, yes. Great question. Absolutely. So harm reduction centers are not exclusive to opioids, I would say. I think it is a place where people, regardless of substance, can receive wraparound services and care. It would, I think that would have to be a necessity for these centers for multiple reasons. I think one, it's the reality of people don't just use one substance. And I think also we don't want to be exclusionary. We want to bring everyone in. Benzos increase risk of overdose significantly, especially when used with opioids. It would not necessarily be limited by substance type.
Thank you very much. I appreciate that. I think this is a great
Yeah.
bill. I really
Yeah.
do.
And I think this is why really keeping general terms, harm reduction center or overdose prevention center, and not, opioid overdose prevention center is important, is really being more and be all inclusive.
Okay. Thank you very much, Doctor. Appreciate it.
Of course.
Thank you for the question. Thank you for the question, Representative Fogarty. Are there any other questions from the committee? Representative Potter.
Thank you, Mr. Chairman. Thank you, Doctor, for your testimony. You provided a lot of really important information, and one thing in particular really stuck out to me. And I just want to make sure it doesn't get lost in the shuffle. You had mentioned that every overdose death last year was preventable. I wonder if you can just reiterate that and maybe expand a little bit on it.
Yeah, absolutely. So, when I say that, it's for several reasons. I think the first is that, we live in a society, in a world where drugs are illegal. In that environment, the drug supply, the drugs that people use, are incredibly potent and act very rapidly, and they're not. There's no quality control, let's just say. So anything could be in there, correct? People don't know what they're getting all of the time. This is what we saw when we started seeing overdoses rise in 2014 when fentanyl was introduced to the opioid supply in Rhode Island. Now those, fentanyl is pressed into pills. If people think they're buying a Percocet, that's not what it is. And then the types of fentanyl that are in the drug supply are increasingly potent. But an opioid overdose with prompt, rapid administration of naloxone can reverse that death, prevent that death. And the only real way to someone to be given naloxone is if someone else is around. So what harm reduction centers offer are support people to prevent people from dying. There's been research done in Rhode Island about whether people would use such a center, which has shown that they would use such a center. It is not the silver bullet for everything. It's not going to be for everyone. But I think for many people, especially folks who are marginalized or maybe don't have a place to go, or people who are experiencing homelessness, or people who otherwise are really, I think, seeking out some more broader social networks and supports, it would provide that. And those are the folks who are at highest risk of death.
Thank you.
And I just think ultimately, to underscore this one last point, I think the spirit of this bill is that every single one of people, like every single life is valuable, and that folks deserve to be treated with dignity and be able to live self-determining lives. And I think that, we can all agree to that. And that's the real spirit, I think, behind, why these are such an important and vital intervention for Rhode Island.
Thank you, Doctor. Are there any
Yes.
other questions from the committee? Okay, so I have a brief question. Doctor, I don't know if you know, I have an EMT background. I'm a firefighter in the Woonsocket Fire Department. Can you please, for the committee and everyone listening at home or watching at home, can you paint a picture of what a harm reduction center looks like? Obviously we're going to be in a certain community somewhere located in Rhode Island. There might be multiple communities. I walk in the door. What is it? What's the situation?
So I do want to point out there are multiple models of harm reduction centers. So they don't look like just one thing. In some places, one of the first ones that was founded, you walk in, there'll be like a waiting area, there's maybe someone at the front desk, and then there's a consumption room. Some facilities have treatment centers upstairs where if people want to engage in treatment, they can enter into a detox bed or treatment bed upstairs. And then so there's models like that, which have a large host of comprehensive services from harm reduction to treatment. And then there's also mobile models where maybe there's a mobile van where they set up a place where people can, a safe space where they can consume substances and receive medical attention if they need it. And that mobile option is more meeting people where they are, maybe out on the street. Rhode Island is a unique place. It will take, I think, multiple types of models and multiple types of places for us to see the true effectiveness of this intervention. Many of the places that have implemented harm reduction centers are dense urban cores. So Dr. Marshall has given testimony about this in the past, but when we see, for example, in Vancouver, when they opened the Insight, they saw a lot of the drug use in Vancouver is consolidated in one place, in one neighborhood. And they saw a dramatic reduction in mortality in that neighborhood. We do have overdose hotspots in Rhode Island, but they're much more distributed in multiple places. There's some in Providence, Woonsocket, Central Falls. There's multiple different places that are heavily impacted by the overdose crisis. So I think we would need to see a few different types of models that are really tailored to the local community and the needs of that community and the stakeholders of that community. That's a kind of spectrum of types of options, but hopefully that provides a kind of helpful overview.
Thank you for that. I appreciate that. Are there any other questions for Dr. Samuels from the committee? Thank you, Dr. Samuels, for your testimony. We're going to move on to our next witness.
Thank you for having me.
Hello?
Hello,
Yes, hello. Who am I speaking to, please?
this is Anita Jacobson.
Hi, Anita. This is Representative Casey from the House Health and Human Services Committee. I have you online with our committee right now to testify on House Bill 5245 regarding the Harm Reduction Center Advisory Committee. If you would, please keep your testimony brief and to the point. And you have the floor at this time, and you have our attention. Go right ahead.
All right. Thank you, members of the committee and chairman. I'm speaking in support of House Bill 5245. As a pharmacist for more than 20 years, I've interacted with and provided care for many people struggling with substance use disorders. But the opioid epidemic affected me personally in 2014 when my partner, Aaron, died of an opioid overdose. He was only 39 years old, and the impact of the loss of his life is felt every single day. From what we can piece together, Aaron met some individuals who shared prescription opioids with him, and he quickly became dependent. He began to experience difficulty with the cost of and access to prescription opioids and was alone and fighting off withdrawal symptoms. In an effort to treat himself, He tried snorting heroin, but was overcome with sedation and never regained consciousness. I truly believe that harm reduction centers where people can use unregulated substances under the supervision of trained healthcare professionals could have saved Aaron's life and will save the lives of many people if implemented. Unregulated substances, including stimulants like cocaine or methamphetamine, counterfeit pills, heroin, are now almost all laced with the potent opioid fentanyl. Fentanyl and its analogs are undetectable to the naked eye and quickly render a person unconscious with respiratory depression. People can't administer naloxone to themselves, and anyone who uses unregulated substances at any time is at risk of experiencing a fatal overdose, whether they're opioid naive or have been exposed for many years. Additionally, harm reduction centers would be an important avenue to connect high-risk people to treatment. Treatment with medications such as buprenorphine or methadone is effective. People suffering from opioid withdrawal symptoms like Aaron was can be managed with medication and go on to connect with recovery resources. Thank you for introducing this important and life-saving legislation, Representative Edwards, and thank you to the committee for your consideration, and I would be happy to answer any questions.
Thank you, Anita. If we have any questions from the committee, Representative Josh Giraldo, please.
Mr. Chairman, it's actually just a comment.
Okay.
Anita, I just wanted to thank you for your testimony. It's really I'm really appreciative and for you coming and testifying and giving us that personal perspective. And I also just want to give a quick kudos to the sponsors for making sure that those affected by substance abuse disorder were included in the advisory committee. So thank you.
Thank you.
Are there any other questions for our witness from the committee? Thank you, Anita, for your testimony. We appreciate it, and we're going to move on to our next witness. Hello, Trevor.
Hi.
Trevor, how you doing? This is Representative Casey from the House Health and Human Services Committee. You are here to testify with us right now virtually on House Bill 5245 regarding the Harm Reduction Center Advisory Committee. You have the floor. You have our attention. If you could please keep your commentary brief and to the point, we would appreciate it.
I will, sir. Thank you. Thank you, House members. My name is Trevor Gaskell. I'd like to speak briefly in support of House Bill 5245 to qualify. Just to let the House know that I know what it's like out there. I was an addict for 20 years, and my reign of terror ended after a year-long bank robbery spree, which resulted in a 6-year prison sentence. So I say that to qualify, just so the House knows I know what it's like out there. My testimony is not statistics. It's not numbers, polls, or budgets. My testimony is personal. I'm testifying in part, in honor of my dead friends. When I went away in 2013, fentanyl had not yet hit the street. When I came home, right before 2019, after the wave of fentanyl, the wave of fentanyl had come through New England and killed everybody I knew. By the time I came home, the people that I had used heroin with for well over a decade were all dead. And people who OD, they die because no one's there to save them, because they're forced to hide. They're forced to hide because of the law, and so they hide, they go by themselves, and they die. I understand why drugs are against the law, I get it, but the rate that people are dying at is just ridiculous, and if someone can't get clean, fails at getting clean, or isn't ready to get clean, that doesn't justify a death sentence. So I'd like to see us just keep these people alive, so they can just, have a chance at life, have a chance to get clean. It's not, nobody who ODs on drugs deserves to die, because they injected because they injected a drug and they had to hide. I see something in 10-3A8 about some criminal liability protection, and the last thing I want to say, because I'm sure you have a lot of people speaking on this, so I'll just try to be as brief as I can, is, that just speaking on my behalf, that's the most important thing that there could be, is insulation from criminal prosecution, whether it be the police sending an informant in there, the police going in there with warrants for people's arrest. Anything that happens in there that results in a criminal prosecution that place is going to be vacant after that. It's going to be abandoned. So that can't ever happen. Or if prosecutions result out of testimony, informants, police, whatever happening inside this place, if this criminal liability protection isn't bulletproof, this place is going to be abandoned. It's not going to have any patrons. It won't be worth the paper it's written on. So I just hope that if 10-3A8 reads, if it is what I think it is, which is criminal protection for the patrons, as long as that's held up, then this place can save a lot of lives. The people don't need to be dying at the rate they're dying at. It's ridiculous. Being addicted to drugs shouldn't be a death sentence. So let's try to save some lives. And I hope that, if this place was around in 2013, then maybe when I came home, maybe somebody I knew would have been alive when I came home, Everybody I know is dead. So that didn't have to happen. And it doesn't have to happen now. So I just want to speak as be as supportive as I can of this bill. I spoke for it in the Senate when it was Senate Bill 16. I'm speaking for it here. It needs to get done. These people don't deserve to die. So thank you for hearing me.
Thank you, Trevor, for your testimony. I know that it's a difficult thing sometimes to do that, and under normal circumstances, you'd be here in person. So I want to congratulate you on taking the time and the initiative to go ahead and testify. Are there any questions from the committee for Trevor?
Mr. Chairman, this is June Speakman.
Yes, June, go ahead. Representative Speakman.
Thank you, Chairman. Yeah, Travis, I just want to thank you for bringing that story forward, and I am sorry for the loss of your friends, and well done on your recovery. I know it's probably the hardest thing you've ever done, so well done, and thank you for sharing your story with us. Thank you, Chairman.
Thank you, Representative Speakman. Yes, Trevor, thank you for your testimony again, and good luck and Godspeed working to continue your recovery. And
thank you very much.
Thank you. We're going to move on to our next witness. Hello, Sarah. Dr. Fessler.
Yes.
Yes, hello. This is Representative Casey from the House Health and Human Services Committee. I have you here testifying on House Bill 5245. We have some of our committee is here in the State House. Others are joining us virtually as well. If you would keep your commentary brief and to the point, I would appreciate that. And you have our attention. Go right ahead.
Thank you, and I will. Thanks for this opportunity. I'm Dr. Sarah Fessler, and I'm speaking on behalf of the Rhode Island Medical Society and the American Medical Association in favor of House Bill 5245. Just a few words. I'll make it brief. Rhode Island and national docs have long recognized that the overdose crisis is not resolving with traditional approaches. While many worthwhile programs such as naloxone and medication-assisted therapy and fentanyl test strips and recovery centers and treatment of the incarcerated have undoubtedly decreased the number of overdoses in Rhode Island, they haven't gone far enough. And we've seen overdoses climb drastically during the pandemic. It's time to support a pilot for a harm reduction center. Such centers have been shown to increase movement and recovery, decrease infectious diseases, and decrease overdose where they've opened. I'd like you to think about something. I would liken this kind of program to a needle exchange program. Initially, it wasn't favored, and eventually, though, it was understood, implemented, and it was very successful in reducing the transmission of HIV and hepatitis amongst IV drug users without increasing the rate of use. So we have an opportunity now to save lives, and it would be sad not to proceed. And that's it. I'm happy to take any questions.
Thank you, Doctor. Are there any questions from the committee for Dr. Fessler? Okay, thank you very much, Doctor. We're going to move on to our next witness. Hello, Michelle? Michelle?
Yes, hello.
Hello, Michelle. This is Representative Casey, Chairman of the House Health and Human Services Committee. I have you online testifying for House Bill 5245. You have our attention and you have the floor. If you could just keep your commentary brief and to the point, we would appreciate it. Go right ahead.
Yes, thank you so much, Chairman and committee members. My name is Michelle McKenzie, and I'm testifying today in favor of House Bill 5245. I'm a public health researcher and have focused the last 15 years on opioid overdose prevention research. And I run a program that's called PONY, or Preventing Overdose and Naloxone Intervention, which in 2020 we distributed about 6,000 kits in collaboration with community partners across the state. And I'm also a person in long-term recovery. Rhode Island has been a national leader in addressing the opioid crisis, in large part due to the critical efforts of this body and state leaders. For instance, Rhode Island was the first state in the U.S. to protect its citizens in the use of fentanyl test strips and other drug checking devices. Given the extent to which fentanyl has contaminated the illicit drug supply, the ability for people to check their drugs is a life-saving measure. And while we've worked diligently to increase the treatment and recovery support for people struggling with opioid use disorder, deaths due to opioid overdose climbed to more than 400 in 2020. This shocking number demands out-of-the-box strategies, and House Bill 5245 provides a truly different approach to saving lives. It meets people where they're at. And while this approach will be novel in the U.S., we have the benefit of years of research in looking at the outcomes of similar services in other countries, especially our neighbor to the north. Dr. Samuels talked about this in her testimony. What started as one harm reduction center in Vancouver in 2003 has grown to 37 sites across Canada. And I invite, in my written testimony, I actually provided a link that describe the different services in each of those 37 sites. And while there's significant data to support this approach, the most important number to know is 0, the number of fatal overdoses that have occurred in any harm reduction center worldwide. There's not one solution to a problem as complex as the opioid epidemic, and it is imperative that we utilize as many tools as possible in addressing this crisis. House Bill 5245 is an important step in expanding the tools in our toolbox. Thank you very much, and I'm happy to answer any questions.
Thank you, Michelle. Are there any questions from the committee for Michelle, please? Okay, Michelle, so I do have one. You are the researcher. I'm hoping you may be able to answer my question. So
Okay.
There's a harm reduction center somewhere in the neighborhood. People who want to people who want to take part and consume, as the term is being used, they bring their, now I'm assuming, they bring their own item of consumption and consume it in the process, in that facility.
Exactly.
Okay, so essentially, any person can bring whatever substance they choose into that facility.
Exactly, for their own consumption.
Okay. All right, that's clear enough for me. Are there any other questions for Michelle? Thank you, Michelle, for your testimony. I appreciate it, and we're going to move on to our next witness. Hello, Hannah.
Hi.
Hannah, this is Representative Casey from the House Health and Human Services Committee. I have you online testifying for House Bill 5245. You do have our committee in proportion. Some are virtual, some are here in the House with us. If you could keep your testimony brief and to the point, I would appreciate it. You have our attention and the floor. Go right ahead.
Great. Thank you very much, and thank you, Chairman and members of the committee, for your time this evening. My name is Hannah Stern. I'm testifying on behalf of the ACLU of Rhode Island. The ACLU is strongly in support of this legislation and believes, like we've heard from so many advocates tonight, and I'm sure we will hear from, that this would be a very critical step towards addressing the state's opioid crisis. However, I do just want to emphasize one point from our written testimony, and I won't go too into detail in our written testimony because it has been submitted, but we would strongly urge an amendment which does provide clients, employees, owners, volunteers, and others involved in a harm reduction center with immunity from liability for violating any drug laws which are currently on the books. This protection from legal fallout, we think, really is essential in order for the center to be able to operate without potentially incurring really devastating law enforcement-related consequences. So we recognize that this bill would ask the Commission to make recommendations on the issue of liability in this regard, but we do believe that a very clear and specific statutory protection would be more appropriate and more helpful. So overall, we are very thankful to the sponsors of this critical legislation, and we hope that it's favorably acted upon. Thank you very much for your time. I'd be happy to take any questions.
Thank you, Hannah. Are there any questions for Hannah? Okay, Hannah, I would suggest if you are interested in looking to have an amendment to the bill that you contact the sponsor and see what type of information you can provide.
Absolutely. Thank you.
Okay, thank you very much. We're going to move on to our next witness. Dr. Montero.
Yes.
Hello, this is Representative Casey from the House Health and Human Services Committee. I have you online with us now testifying on House Bill 5245 regarding harm reduction centers. You have our attention and the floor. If you could please just keep your commentary brief, we would appreciate it. Go right ahead.
Excellent. Thank you, Chairman, members of the committee. I will be very brief. Everyone else who has testified before me has had such excellent testimony. So all I will say is that I strongly support this as a member of the public, and I urge all of you to support the passage of this legislation. And that's all I have to say.
Well, thank you very much. The committee appreciates that. Are there any questions from the committee for Dr. Montero? All right, Dr. Montero, thank you very much. We appreciate it.
Thank you.
All right,
Thank
bye-bye.
you. Take care. Bye-bye.
We're going to move on. I believe we had one more witness. Okay, thank you. Hello, Roxanne?
Yes.
Roxanne, this is Representative Casey from the House Health and Human Services Committee. I have you online. I have you online right now testifying for House Bill 5245 regarding harm reduction centers. If you would just keep your commentary brief and to the point, and you have our attention, go right ahead.
All right. Thank you so much, committee members. I am calling in support of House Bill 5245. My name is Roxanne Newman. I am a research assistant at the People, Place, and Health Collective at the Brown University School of Public Health. I'm also a researcher. My primary interests are in recovery, and an academic, and I understand the research very well and have read a lot of it. But I'm calling in today to offer a different type of expertise, and that is lived experience. So I think that the most important evidence that I could give in support of these sites is my own personal story. So I'm a person in long-term recovery, and I am a former IV heroin addict and an overdose survivor. I would love to give you a snapshot into what it was like for me when I was using. When I was using, the majority of the world, whenever I had any type of interaction with them, treated me like crap. They made me feel like I was worthless and I had no value. This would happen in medical facilities, in the correctional facilities, interactions with police officer, and interactions with the general public. And all it ever did was reinforce how I felt about myself, that I had no value and that I was worthless, and that continuing to use was the only way that I could cover that up. But I will tell you about a moment that happened that I think about on a weekly basis. It's been 9 years now that I've been in recovery, and I still think about this woman. I was outside trying to obtain money in order so that I could avoid the withdrawals that would eventually go through. And a woman pulled over on the side of the road, and she walked up to me, and she handed me $5 and her phone number, and let me know that I could call her if I needed to get help. And she gave me a hug. And it was the first time in a very long time that I have felt human compassion and empathy. Now, I tell this story to reiterate what Dr. Samuels had discussed in the beginning of this, was that the behind this bill, there's a sense of giving back human dignity and value and empathy. I look at these centers as centers of hope, which might be completely ludicrous to think of. But people who will utilize these centers, who are actively using, still value their life in some way, shape, or form. Whether they're cognizant of it, I am not sure. But to go into a place where people still value you, that understand that you're struggling and continue to give you compassion, is beyond anything that you could offer. And I feel as though these sites will be that way for a lot of people, and they need it. In their darkest hours, they need that. I needed that in my darkest hour, and I'm so grateful for the woman that gave me that. In August of 2015, I stood at a podium with Governor Gina Raimondo next to me, and I gave a snippet of my life and my recovery story, and she signed the executive order for the governor's overdose task bill. I've sat on the overdose task force. I sit on the harm reduction working task force. I sit on task force after task force after task force. We're going on 6 years, and it's gotten worse. It is not getting better. People are dying at record numbers, and we need to do something to fix this. And we have, and like Dr. Samuels had said, this is a tool that we have not used yet, and it's desperately needed. So I'm just grateful that I'm here today to give you, part of my story, and I'm here to answer any questions that anyone has.
Thank you very much for your testimony. Are there any questions for the witness, please? Representative Fogarty, go ahead.
No, Roxanne, I just want to thank you for your testimony. It was very, very powerful, and like you've been on the task force for 6 years, and that was still having these types of deaths really kind of hit home with me. I think that this is an option that we haven't looked at, and we have to do it because, just as a personal note, I have my nephew's best friend just a week ago just overdosed. Genius, brilliant, went to McGill University, got his degree, went to Yale, got his master's degree, was going back for his doctorate, but couldn't, it just got him. And so just was buried this week, and just absolutely brilliant. And I think some people probably, just didn't give him the compassion that he needed when he was really getting high, and it struck a chord. So I appreciate your testimony, and good luck with you staying healthy and using your good at the Brown Public Health and helping others. Thank you.
Thank you.
Thank you, Representative Fogarty. Roxanne, thank you again for your testimony, and good luck staying on track with your recovery as well. It's a very difficult thing to do, and congratulations on what you've been able to do to help with the opioid crisis. I appreciate that. Are there any other questions for Roxanne? Okay, we're going to move on, Roxanne. Thank you very much for your testimony. We're going to move to our next witness. Thank you. Hello, Haley.
Yes.
Haley, this is Representative Casey from the House Health and Human Services Committee. I have you online testifying on House Bill 5245 regarding the harm reduction centers. You have our attention. If you can keep your commentary brief and to the point, we would appreciate it. Go right ahead.
Will do. And thank you, Chairman Casey and honorable members of the committee. My name is Haley McKee. I am co-chair of the Substance Use Policy, Education, and Recovery PAC. I am also a person in recovery from IV drug use. And I'm here tonight in strong support of Bill 5245. I feel like I'm not going to be redundant and echo what during this testimony, but I've always kind of found it baffling that as a community we grieve losses when a person passes from overdose. And on the flip side, there's people like myself who there's a good for you mentality. There seems to be a current gap in our system, and I think that a facility such as the Harm Reduction Center would fill that gap to meet a person where they're at. Because we've kind of acknowledged collectively that substance use disorder is a medical condition, and in turn that should require a medical facility such as a harm reduction center. And the aim of one of these facilities wouldn't be to enable people to use drugs, which is something that we hear quite often. It would be to actually prevent overdose death, and I can see why a person would seek out one of those facilities during a recurrence when they're fearful that their tolerance is low, which they acknowledge that they put them at risk when they've lost a close friend, or during a contemplative stage while they're exploring other treatment options. I work with people who use drugs, and I'm just going to share a couple of quick vignettes from people who are in active use. One person stated, "If I have a recurrence, my girlfriend will watch over me just in case something happens to me." Another person stated, "I watched my partner overdose and realized that we had taken a laced dose. I knew that I was about to overdose and just got out of the bedroom as soon as I could and managed to fall down the stairs where my grandmother found me." Another person says, "I don't know how long it took for them to find me. I was somehow in a closet with my leg broken and wrapped around my neck. They hit me with 10 times with Narcan and finally put the Pulp Fiction movie needle in my heart. I was in the ICU for 1 month after. I still can't finish sentences, remember simple things. I was out for too long. Something happened to my brain." And finally, another person says, "I wish I'd had this Narcan given to me last year. I was with my friend in Providence Place Mall in the bathrooms when he overdosed, and by the time the EMTs got there, 10 minutes later, he was blue, gone." And I think that this bill is important, and it should pass because with the potency of our substances, we're giving people 1 dose of Narcan and basically a pat on the back and saying good luck. But we're charging the general public to jump in on overdoses and administer life-saving services. And if we could have these evidence-based facilities come into practice, it would surely be a life-saving facility. So thank you for your time and for your bill, Representative Edwards.
Thank you, Haley. Thank you, Haley, for your testimony. Are there any questions for Haley from the committee, please? Representative McLaughlin?
Yes, Haley.
Hi, Representative.
Thank you so much for your testimony. Are you familiar with any agencies like Narcotics Anonymous?
Sure, yeah. So there's a lot of mutual aid support groups where people can access support groups within people's networks, and they're certainly useful. Yeah, I'm a person who's done a lot of time in AA halls and NA halls myself, so most certainly.
Okay. Are you familiar with an organization that years ago they had Kodak?
Yeah, the clinic, the medically assisted recovery clinic, sure.
Are they still offering services like methadone treatment?
Absolutely, sure. So there's a lot of different agencies that are currently offering medically assisted recovery. In the context of this legislation, that's for people who are more actively engaged in recovery. A harm reduction center would be for somebody who's in more of a pre-contemplative or contemplative stage in their youth, where they're not quite there yet, where when you're using heroin, and I can speak to this from firsthand experience, there's oftentimes an active fear because you know that there's a strong possibility that you can pass away from your use, and it's quite scary. And I can certainly see why a person would access one of these facilities prior to maybe engaging in a Kodak or an NA, because unfortunately we're not always there all the time, but this helps meet people where they're at, where we don't lose people in that current gap in our services. But all these other things are very, very useful as well, and they're all big pieces to the puzzle. This is just the piece that I see is most significantly missing at this time. And this is where we're losing people. Does that help?
I want to thank you so much for sharing.
Thank you, Representative.
Thank you, Haley. Are there any other questions for the witness? Thank you, Haley. We're going to move on to our next witness. We appreciate your testimony. Hello?
Hello?
Hello, Ashley?
Yeah.
Hi, this is Representative Casey from the Health and Human Services Committee at the House of Representatives. I have you online with the committee right now to testify on House Bill 5245 regarding harm reduction centers. If you would keep your testimony brief, we would appreciate it. You have our attention. Go right ahead.
Okay. Thank you, Chairman Casey and honorable members of the committee. I am here in support of Bill 5245. My name is Ashley Perry. I'm a person in long-term recovery from opioids, and I currently work for an organization named Project Web Renew as a peer recovery specialist. I concentrate most of my efforts on street-based outreach, providing harm reduction tools, education, and case management to some of Rhode Island's most vulnerable residents. Today, instead of telling you all that harm reduction centers save lives and are the only evidence-based way that we have not yet tried to save lives, or the sad and disappointing numbers of lives lost, or the pure trauma and devastation that I have witnessed firsthand working on the front lines of both this pandemic and epidemic, I would like to tell you all a story about a woman named Dawn. I met Dawn on a warm October day I will never forget. I was doing my normal outreach rounds when I was observing what I thought were two men breaking into a car. When I got closer, I saw that they were actually trying to get someone out of that car. That someone was Dawn. I soon realized that she was experiencing an overdose, so I quickly drew up some Narcan, and as the men broke her free from the car and laid her on the sidewalk, I started this process of administering Narcan that I have taught 100 times. I performed full CPR on Dawn and injected her with over 5 units of Narcan before the ambulance even arrived. But she was still lying there, lifeless. The EMTs took over, and finally, after some work, she came back to life. When I finally stood up, I cried. I looked around me and saw that the whole community had stopped to watch the horror. There were children getting off the bus, and I wondered what their mother would say to them or how she would explain it to them. Everything about this situation was wrong. I had glass in my knee from the broken car window. I was very angry at the police standing there doing nothing to help. I was angry at the EMT who showed aggravation that he had to be in the same neighborhood again for another overdose. And I was even more angry at all the people standing by recording on their phones. Overdoses are traumatic to our whole community, not just the people overdosing, but for the responders, for the kids, for our residents. We need to respond to this crisis the same way we would for any other body of sick and dying people. I work in these overdose hotspots every day. I had never saw Dawn before that. I later learned that she had just relapsed after being 8 years sober. Dawn did not make it to see the next year, dying of an overdose shortly before. And the sad truth is, so many stories are just like Dawn's. We need to stop criminalizing and shaming the sick and discarding people. We are dying at record numbers, and we really need help. Thank you.
Thank you for your testimony, Ashley. Are there any questions for the witness from the committee? Thank you, Ashley. We appreciate your testimony. We're going to move on to our next witness, please. Hello, Dennis.
Yes, hello.
Hi, Dennis. This is Representative Casey from the House Health and Human Services Committee. I have you testifying here on House Bill 5245. You have our attention. If you could please keep your commentary brief and to the point, we would appreciate it. You go right ahead.
Thank you, Representative Casey. I certainly will try to. Thank you, committee members. My name is Dennis Baylor, and I'm here to testify in support of Bill number 5245. All right, so let's see. I work for a peer-led organization called Project Web Renew. I'm a state-certified community health worker, peer recovery specialist, and a peer recovery specialist. I've been working in this field doing street outreach, boots on the ground, for approximately 7 years. And the one thing that I can tell you that you've already heard is that more and more people are dying on our streets, even if they don't suffer from opioid use disorder. Maybe they want to try some cocaine. Maybe they want to pop some pills. But the death rate is skyrocketing as a result of this synthetic drug called fentanyl. The Harm Reduction Center will allow every individual who wants to take the opportunity to test their drugs. I mean, it's not just the person with substance use disorder that you might think you see on TV who's just down and out and living a hard life. I'm talking about high school students, college students, what you might consider good members of our society who are dying as a result of fentanyl in the drugs. The Harm Reduction Center serves numerous purposes as a tool to help prevent some of these deaths. Now, every death is preventable. Unfortunately, we're not going to prevent them all. But how many more deaths do we have to see before we're going to take extraordinary steps to try to make a difference? I value these lives. That's why I'm out there every day doing outreach, engaging individuals, meeting them where they're at, offering them harm reduction tools to the best of my ability to help keep them alive until they're ready to stop. The state can take those same type of efforts, doing what it takes to try to save lives, going beyond what's the norm to try to save some of these lives. Again, I don't want to take too much time, but I see this day in and day out. The people who do outreach, many organizations doing outreach know that if some of these people had a safe place where they could go, they wouldn't wind up in alleys, behind trash cans, in public bathrooms, overdosing. They can go to one of these safe places, be monitored by professionals and peers. We want to see peers in those locations because we understand. I'm a person in long-term recovery, so I understand the battle, the struggle, and also the hope and the possibility of recovery. So I just ask that we take extraordinary steps because each and every one of these lives are worth those steps. Again, my name is Dennis Baylor. I'll be happy to take any questions if you have any.
Thank you for your testimony, Dennis. Are there any questions from the committee? Thank you, Dennis, for your testimony. That will do it for all of our witnesses. So at this point, I will close the hearing on House Bill 5245, and we'll move on to our next bill.